So first thing to just say about non-communicable diseases is that when we talk about surveillance for communicable diseases, we're doing surveillance for either the diseases occurring in people or the infectious agents out there in the environment or in animals. With non-communicable diseases, the traditional approach has been to look very much at the endpoints. So the data that we've traditionally had available, unfortunately, have been things like mortality data or hospitalization data. So you take something like coronary artery disease, and we can have the number of heart attacks that are admitted or the number of people that die of heart attacks. Those are very crude and I would say very late state sort of outcome measures, which are important to monitor for a whole bunch of purposes. But if you're actually going to plan and improve on population health, you need to move your surveillance upstream to the risk factors for those kinds of diseases. So we have to look at what are people eating, we have to look at are people smoking, alcohol consumption, physical activity. And so right away, the challenge we get into is we move from doing surveillance on things that the health system has ready access through administrative sources, hospitalizations or vital statistics, to looking at data that may be coming from very different sources or may simply not be readily available, and we have to get it through surveys, through Statistics Canada, types of surveys like the Canada Community Health Survey. So the limitations that we've had traditionally in doing non-communicable disease surveillance is that we don't actually have the right kinds of measures, and when we figure out what those measures are, they're not easily available. So if you say what's been the progress since Naylor in 2003 and SARS, we've been making progress, but it's been much more slow because we have to still develop what those key measures should be, agree upon that, and then figure out what the data sources for that are going to be. For many of them, it is going to come from surveys, which are more expensive to do, don't give as good data at a small area or regional local level. And so we still have work to be done around that. In terms of progress, there's certainly been quite a bit of work done both in Ontario and nationally in terms of setting what those core indicators might be. And they're well accepted indicators in Ontario from the public health epidemiologist, nationally from Canadian Institute for Health Information and their various health reports that they do. And the next step is really going to be to start to figure out how we can have sustained and regular collection of that kind of data in a comparable level across the country. Do we have the balance right? Certainly our organization, because of the focus following SARS, is very heavily invested and working in the communicable infectious disease area. We need to do more in non-communicable diseases, in chronic diseases, in environmental health. I would suggest probably the same is true for Public Health Agency Canada across the country. I think the challenge that we face in public health is there's usually attention to what we do in public health when there's an event like SARS or H1N1, when there's an anniversary for SARS. There's not as much attention to the work of public health on the day-to-day work around dealing with these broader social determinants of health, with the risk factors for chronic disease. So we've had some attention in the last few years around childhood obesity, both federally, a great deal of work with the federal, provincial, territorial ministers adopting a report on childhood obesity. In Ontario, the Minister of Health had a Healthy Kids panel, which is expected to report out in a few weeks. So I think we've had some greater attention, but quite often that does not necessarily correlate with looking at what the role of public health should be and how public health can work in the same way it does around communicable disease control in non-communicable disease control. But in terms of your question around confidence, certainly we are far more confident than we were at the time of SARS that we are getting all of the reportable diseases, and that if we had to manage an outbreak, we wouldn't be doing it with sticky notes on a poster board, which is what the famous story about Toronto Public Health during SARS. If there's gaps, certainly we've probably not come as far in the area of integrated surveillance systems as the reports would have liked to recommend. I think the challenges around communications between the international authorities, federal, provincial, territorial, and then down to the local level to frontline providers, while we've come a long way, to refer to the coronavirus, that example and H1N1 also showed us that there's still gaps, right? And there's just given the complexity of these sort of issues, there always will be gaps, but I think there is work that needs to continue to be done. And then the final point I leave you with, I think the non-communicable chronic disease environmental health areas, which is where our really big public health challenges are, do remain. And so while we've had a great focus on communicable diseases and we cannot lose the gains that have been made, we also have to get the balance right with the other public health challenges.